All right, let's talk about a real medical mystery. We're going to dive into a dangerous pathogen that is an absolute master of disguise. It can cause devastating liver disease, but it does it so sneakily that it often flies completely under the radar.
And it all starts with this one central puzzle. Imagine you have a patient who is incredibly jaundiced. Their skin and eyes are yellow, which is the classic sign that the liver is in big trouble. But when the doctors take a closer look at the liver itself, the cells aren't actually dying off. So what on earth could be going on?
Well, the answer lies with this hidden culprit. It's a tiny bacterium called Leptospira, and it's the mastermind behind this whole perplexing situation. So what exactly is Leptospira? Well, it's a type of bacteria called a spirochete, which just means it has this really distinct corkscrew shape. You find it in water, but the real trouble starts with infected animals. We're usually talking about rodents. Their urine can contaminate water sources, and that's where the danger for us begins. It's a huge yet so often overlooked cause of acute hepatitis, especially in tropical areas or after heavy flooding.
The way it makes the jump to humans is actually pretty straightforward. First, you come into contact with that contaminated water, and the bacteria gets into your body, usually through little cuts or scrapes in your skin, or even just through your eyes or mouth. Then, step 2. It slips into your bloodstream and starts its journey through your organs.
So once it's in the bloodstream, Leptospira can go to a lot of different places, but it has a particularly nasty and really unique way of attacking the liver. And here's the twist, the thing that makes this so different. Unlike a virus like hepatitis C that just comes in and kills liver cells, Leptospira doesn't do that. It doesn't cause this big messy cell death. Instead, it causes a functional disruption. It's like it doesn't demolish the factory, it just goes inside and messes with all the wiring in the pipes so that nothing works right anymore. Seeing this comparison makes it all click. On one side, you've got viral hepatitis, which often causes what we call massive hepatocyte necrosis. That's just widespread death of liver cells. But with leptospirosis, you get this cholestatic picture. The cells are there, they're alive, but they can't do their job of processing and moving bile. So you get this massive traffic jam of bile, which is exactly why the jaundice gets so intense. Okay, so if the main symptom, jaundice, can look like other liver diseases, how do doctors solve this mystery? How do they pinpoint Leptospira? Well, it's all about looking for a very specific set of clues. So what are they? What are those telltale signs, the key clues that help distinguish a Leptospira infection from all the other possibilities? The biggest clue by far is that Leptospira doesn't just hit the liver. No, this is a multi-system disease. So, along with that severe jaundice, doctors are looking for acute kidney injury and even bleeding problems because it can mess with your blood platelets. There's also a very specific sign called conjunctival suffusion. That's red eyes, but with no pus or discharge. And a classic two-phase or biphasic fever is another big giveaway.
But the real smoking gun? It's right here in the lab results. This chart shows the pattern perfectly. You see the bilirubin, that's the stuff that makes you yellow. It's skyrocketing, maybe over 20. But then you look at the liver enzymes like AST and ALT, which measure cell death, and they're only a little bit elevated. This massive mismatch is the key. The jaundice is completely out of proportion to the actual liver cell damage.
Once all those clues point toward Leptospira, the clock is officially ticking. The focus has to shift immediately from diagnosis to fighting back against this infection, and fast. The good news is that since it's a bacterial infection, it's treatable. We have antibiotics like penicillin and doxycycline that work well. But the critical factor here is speed. You have to start treatment as early as possible to knock the illness down and prevent those really serious complications. And, of course, you also need supportive care to help the struggling liver and kidneys hang on. But that need for speed creates a real-world challenge. As this quote from Dr. Deepak Kopge points out, you can't always wait around for the lab tests to come back and confirm it. That can take precious time. So in places where this disease is common, if a patient shows up with the right symptoms and a history that fits, like maybe they were wading through floodwater, doctors will often start the antibiotics based on that strong clinical suspicion alone. They treat what they see.
So, after going through this whole complex disease, what's the single most important lesson? What's the one thing you really need to take away from all this?
It all boils down to this. For doctors, and really for all of us to be aware of, This combination of symptoms should set off huge alarm bells. If you see unexplained jaundice happening at the same time as kidney problems, you have to think about leptospirosis, especially if there's any chance of exposure. Recognizing it early is everything.
So, we've uncovered the pathogen, we've seen its methods, and we know the clues it leaves behind. The final question really is for you. Now that you know the source is often just contaminated water from floods or ponds, and you understand the signs, it just gives you a new awareness of the world around you, right? What might look like just a harmless puddle could be a hidden danger. Thanks for joining us for this explainer.